The Unfiltered by Jade.
Jade. Welcome to The Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records, a proud sponsor of The Unfiltered by Jade.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget.
Welcome back to The Unfiltered by Jade. Today we have with us Dr. Warren Mullings, and he is a fellowship-trained endoscopic sinus and skull-based surgeon. And his alias is the Snot Doctor. We're going to get into that because just like how you guys are wondering, I'm wondering too. So hi, Dr. Mullings. How are you?
Hi, Jade. Thank you for having me. I'm great.
Awesome to hear. So first of all, tell us about the Snot Doctor. How is it that you came about that name and that alias?
It was during fellowship when I was in Canada. I trained in Vancouver.
Mm-hmm.
And we would always be working inside the nose. That's what we did all day long. Throughout clinic, in the operating room, we operated on nowhere else but in the nose. And we were always dealing with snot. So we came up with all kind of jokes about snot. So that's not funny.
He did.
Or we're fun guys, because there would be fungus in the nose. So we're fun guys.
Oh my God.
Oh, we're the Burger Kings.
Oh my God, no.
So one day I was like, I'm the Snot Doctor. And it stuck.
Oh God.
So
Okay.
That's how it happened.
That's one of the most weird things I've ever heard. But I guess if you're in there all day, it makes sense.
This is what you do. You get comfortable with it.
It makes sense. And I mean, it's not probably what's the word? It's probably not that what's the word to describe it? You don't feel a certain way about it because that's what you deal with.
Absolutely. And this is the issues that people face, and they want to know that somebody is not going to be afraid to or skirmish around them. So this is where I reside, and that's where I'm happy.
He said that's where he's happy. All right. So Dr. Mullings, what is sinusitis?
So sinusitis is a term that we use to describe inflammation in the nose and the sinuses.
Okay.
So the correct medical term is rhinosinusitis, rhino for nose, and sinusitis, or to represent the sinuses. And the sinuses are a separate part. There are these air-filled cavities which are around the nose in our head, filled with air, so that we're not walking around with a block of bone and our head is not heavy. And we actually have about 8 sinuses, 2 on each side, 2 above the eyes, 2 between the eyes, 2 below the eyes, and 2 behind the eyes. So it's inflammation in the nose and sinuses.
Okay, then. It's funny. Growing up in Jamaica, we hear about sinusitis.
Yes.
And it's always, when you see people blowing their nose, or they're always stuffy.
Yes.
But to hear that we all have
sinuses.
Yeah,
absolutely.
It's new.
So that's easy to explain. As I came back, and everybody's like, "Oh my God, everybody in Jamaica has sinus." I laughed because I was like, yes, that's right. There is a structure in everybody called
Okay.
sinuses, but not everybody has a disease or inflammation of their sinuses.
Always. And that's important to know.
Absolutely. So what happens, what I found is that we actually don't have all of Jamaica does not have sinusitis. But what
Okay.
we have a lot of is allergies. And we have a lot of people whose noses are irritated by dust and pollen and smoke and viruses and reflux. There are a number of things that are irritative
Okay.
to our nose, and I'm particularly concerned about air pollution in urban
Okay.
settings, which is another area of interest of study for me.
Okay.
Uh, and then there's about 15% of the population, a sizable percentage, but not the majority,
Okay.
who have chronic inflammation
Okay.
longer than 3 months inside their
Mm.
nose and sinuses.
Okay.
So that's the big distinction.
That's a bit okay. Okay. I mean, yeah. I mean, okay. Okay. Thinking about it now. Okay. I understand that, but it's easy to get confused with it, though.
Absolutely. And it's our job to distill and to explain constantly to everybody that we meet, because we have a tradition of calling everything sinusitis or
Oh
sinuses
yes,
or
we do.
sinus problems.
Yes, we do.
Absolutely. And I see it every day, but we just explain it, and then people understand a lot better, and they appreciate their symptoms more, and we're able to manage it better after.
Okay, okay, no problem. All right, so because I am not so vast in it, if there's anything that I've said or asked, you can freely correct me with
Oh,
it.
absolutely. That's why we're here.
All right, all right. So there are different types of sinuses, right? So can you give us different types?
Yeah, so I can tell you the names of them.
Okay, go ahead.
So they're the frontal sinuses. Those are the ones in your forehead.
Okay,
You have the ethmoid sinuses.
okay,
These are the ones between your eyes.
okay,
You have the maxillary sinuses. These are the ones below your eyes.
okay.
And you have the sphenoid sinuses. These are the ones behind your eyes. And they're given their names based on the names of the bones that they are in. So there's
Mm,
actually a frontal bone and an ethmoid bone and a maxillary bone and a sphenoid bone. And it's
mm,
these air spaces within these bones which are called sinuses.
okay.
And they're all surrounding the nose.
But do they have different like symptoms? Like you can say okay because okay, I'm not remembering the names, but like say the ones under the eyes or so.
Right.
Does it give a different effect than the one behind the eyes, than the one at the nose? And
Yeah, so we do think that there are some isolated sinusitis symptoms. So, for example, if your sphenoid sinus, these are the ones behind your eyes,
mhm,
are blocked and obstructed, then people can have a headache in the center of their head. They can, for example, have a drip down the back of their nose because that sinus actually sits right above the throat.
mm,
They can actually have visual disturbances. They can have loss in vision if they have a serious infection in that area. We can get involvement of the brain and so on. So
wow,
it does depend on the location of the disease, and not only the location, but the type and the severity of the
mhm,
disease involved. And not all sinus inflammation is the same, and they're actually quite different types. But I think generally, if you're talking about sinusitis, we step back and we say, the symptoms that are common generally is uh, patients who will have a loss of smell is one,
mhm, okay,
uh, discharge from the front of the nose,
okay,
we call that rhinorrhea. Nasal congestion or stuffiness is another. Facial pain or pressure, so that's pressure above the eyes, between the eyes, below the eyes, or even behind the eyes.
okay,
Not only pain, but even just pressure. So some people will have a blocked sinus below their eyes, and they'll speak about their cheek just really hurts, or they have a
mm,
lot of pressure there. And headaches are considered, one of the associated symptoms, as well as sometimes bad breath or halitosis. But generally, those are the we'll call those 5 major features or
Okay.
symptoms of sinusitis. And they can either be acute, meaning that your symptoms last for less than a month, or they
Okay.
can be chronic, where your symptoms have been ongoing for 3 months and longer.
And longer. Okay. So how is it that we know when is it that we need to get it treated?
It's very common for adults.
Mm-hmm.
When I say very common, on average, the adult will get 2 to 4 viral infections in a year, on average.
Okay.
And they will get nasal congestion, they may get a drip down the back of the nose, they get a runny nose. They're usually caused by a virus,
Okay.
rhinovirus, for example, and they would normally get better within a week.
Okay.
Or a little bit over a week. They'll take some over-the-counter medications. They may go to their doctor and get some nasal sprays. And usually with this symptomatic therapy, things that make them feel better, they'll use misters and so on. They'll be back to their normal selves in a week or so.
Okay.
Once you have had that going on, but you would have been trying some of these therapies and you worsen, so we call that double worsening. You've been having it for a week, but then you got worse after the 5 days. That's when we think you need to see a physician, a doctor, your general doctor, for example, as we often think that's when a bacteria has started to take hold and you may need some antibiotics, which does require a prescription and certainly a diagnosis to be made. But so certainly double worsening is important. Once you have symptoms that, despite you going to the doctor, your general physician, and your symptoms have been going on for 3 months, unabated, or even with small breaks, but you keep getting it back and you're not improving but worsening over time, you might find that your asthma is getting worse as well, or you may have developed asthma as an adult when you never had that before. Or if you take aspirin and somehow it makes you worse, or you drink alcohol and it actually makes you worse. There are some people like that. That's when you need to see a specialist. That's usually when you have a more complicated kind of disease, because it's not all simply a bacterial infection. And in fact, we think, or we know based on our work in the area and the studies, is that chronic sinusitis, that's those who have disease lasting longer than 3 months, it's a multifactorial disease. It's not simply a bacterial infection that won't go away. It can be the case, but sometimes it can be due to allergies. At other times, it can be due to what we call an anatomical variation. In other words, the structure inside your nose doesn't allow for your sinuses to drain well and cause it to become repeatedly infected and inflamed. It can be due to autoimmune conditions. It can be due to tumors. It can be due to inherited diseases such as cystic fibrosis. It can be due to a fungus, an allergy to a fungus that is present in the air that everybody breathes, but you are allergic to. It could be due to dental problems.
Oh, sorry, there are many factors that actually can cause this.
Absolutely, and that's why we spend so much time studying and working in this area, because you do have to distill all the possibilities so that you can get to the root of the problem and cure it. Because what happens often is that there's a tendency to treat people with the symptoms the same way. The symptoms are the same, but the causes may be different. So if you don't get to the cause, then you'll keep using the same medications with very little positive impact.
Yes. So what he's saying, guys, is to go and get it checked out and don't drink ginger tea.
Nothing against ginger tea, by the way.
nothing against ginger tea, but
it's a superfood. It's a superfood, but it doesn't cure it all.
Right. my God. So don't depend on just ginger tea, guys. Go and get it checked out. Oh my goodness. What is the link between sinusitis and snoring?
That's a great question because a lot of people believe that there's a strong link, and there actually isn't a strong link.
What?
Yes, there is a link, to be fair, but snoring is a disease entity. Well, let's not call it a disease. Snoring
Please,
is
because
fair. I take it back. Snoring is you have this audible sound when you sleep at night, and it's often due to vibration, soft tissues in the upper airway when you sleep.
okay.
Now, snoring can either be primary snoring, in other words, you just have a lot of excess tissue in the upper airway, it vibrates and you snore. Versus it can be due to another problem which we call obstructive sleep apnea, where there are areas which are narrow in your airway, you're struggling to breathe at night, your oxygen levels are falling, you're not getting sufficient air, you're not getting sufficient sleep, and you are obstructed when you sleep at night. You snore often,
Mm-hmm.
and you get poor rest, but it also sends up your blood pressure, it sends up your stress on your heart, on all the other organs in your body. So that's a condition in and of itself
Okay.
that we know is multifocal. In other words, the impact of obstructive sleep apnea is not only in your nose, but it can be at the back of your nose, the back of
Oh.
your mouth, in your neck. And oftentimes, we know that if we do things to make you breathe better through your nose, we improve your oxygen delivery. But in and of itself isn't a cure for snoring or a
Mm-hmm.
cure for obstructive sleep apnea. And certainly the problem is much more than just your nose.
I mean, I guess people thought it was because you can't breathe properly, so you have sinus problems, and
Exactly.
then we know people that snore with trucks. It's trucks, and we're trying to figure out what is happening.
Yes,
But I mean, I do get it when you say some people it's hard for them to breathe because
absolutely. What we find with this endemic in snoring is actually weight gain. So what happens is as individuals get older, they put on weight around their abdomen, around their chest, around their neck. And with that increased weight gain, when you sleep at night, that excess weight kind of falls, not falls, but it compresses the windpipe in a lot of people, or makes it tighter and creates more difficulty in breathing.
interesting.
It's just one
That's
of the factors. Weight gain isn't the only
the
one.
only factor. Understood. But that's interesting. I don't think we really sat and thought about that before. That weight gain probably has
Absolutely. And we,
something to
we
do with
see
it.
lots of patients who are serious about their weight loss and have avoided surgeries or even what we call CPAP therapy in order to regain restful sleep.
Tell us about endoscopic sinus surgery and what it entails.
So endoscopic sinus surgery is the main tool in our
Mm-hmm.
armamentarium
Mm-hmm.
to gain access to what we call the sinuses or the paranasal sinuses.
Mm-hmm.
We use tiny cameras through the nostrils to gain access to the sinuses as outlined before. The
Mm-hmm.
sphenoid sinus, the maxillary sinus, ethmoid, and frontal sinuses. We also use the endoscope, which is this tiny camera,
Mm-hmm.
to gain access to your brain if we need to. For example, the pituitary gland, if there's an issue there, or if there's tumors in your brain, we can do endoscopic surgery in other
Mm-hmm.
areas of the brain other than the pituitary, um, to gain access to
Okay.
your brain. We also use the endoscope to gain access to the orbit or the globe if there are issues there as well.
Mm-hmm.
And there's actually we can also use the endoscope to get access to the skull base, and there are structures where the brain, basically the floor of the brain sits on,
Right.
and even the upper part of the spine. So endoscopic surgery is a big field
Mm.
that really details how we use what we call minimal access. In other words, we don't do any cuts to the face, no bruising or scarring, for maximal exposure. So you get wide visualization of very important structures. So the images are magnified significantly times 10, so you can see exactly what you're doing much better than with your naked eye. And so that's what endoscopic surgery is. It's passing their cameras through your nose to get access to varying structures that we can operate on to improve.
I'm not finding that very comfortable.
Well, one of the benefits of this is that we do it when you're asleep, majority of our procedures. So
okay. I'm just sitting down and imagining this, and it's not really comfortable for me. It's not.
And pass our endoscope in our clinic in people's nose daily, and we don't often use local anesthetic because people have become so comfortable with it. And that's because it has a lot to do with scope handling and the person just being comfortable and sitting and relaxing. And so we are able to pass and look into all your sinuses with your awake without much discomfort.
Oh, really?
Yes, indeed. Our cameras are like 3 millimeters in size.
That's tiny.
Yeah, so we've been able to really, the technology has improved tremendously to allow us to go in tiny spaces with minimal discomfort.
I've watched a couple of your videos that you have put up with you going in and taking out stuff, and it looks interesting and it looks disturbing.
Yes.
I mean, to get those things, and I'm like, how does he get those things out of someone's nose? Because some of them are big.
Yes, they're huge. They are huge. And the benefit of where I work and the work that we do and the training that we have is that we have an incredible amount of technology that allows us to work in tiny spaces for a limited period of time. And so we use the latest technology and 4K cameras that really give us a very magnified view. And we have things called debriders, which are tiny cutting instruments that will make tiny cuts, millimeters small. We have navigation, which will tell us where we are at all times. So this is like a computer that says, oh, you're in this cheek sinus and you're 1 millimeter away from the eye, or you're 1 millimeter away from the brain. And we're able to... That's pretty
cool.
Yeah, and so we're able to operate with confidence in very tight, close spaces.
When did you discover this method, and how safe is it?
It was while doing my ENT training that I was introduced to endoscopic sinus surgery. But I remember very clearly going to a conference while in training in Puerto Rico, and just sitting at a round table with a lot of the leaders in the field in endoscopic sinus surgery. At the time, this was probably about 10 years ago, 10, 15 years ago. And just amazed at just the explosion in growth in the field that was happening and coming. And I was like, I have to be a part of this because it's just so exciting, and just the difference in which we're making in people's lives, and how much we're able to improve their lives with minimal morbidity. People are going home on the same day and feeling fine. That really was what attracted me to this area. Our complication rates in endoscopic sinus surgery, thankfully, are low. For the majority of the procedures that we do, we find that our complication rate is less than 1%.
Okay.
And so we approach surgery in that way. We have different surgeries though that we do that may have a higher complication rate, particularly when we're doing tumors and endoscopies. But certainly we find that we have a very good outcomes for the patients who undergo endoscopic sinus surgery.
Okay. How long does it take them to recover from the surgery and start breathing properly again or feeling better?
So generally for the patients who we operate on for sinus disease, they're home for a week. They do rinses for a week. Certainly so they wake up they do the surgery today, they go home on the same day, so they recover.
Okay, so it's an outpatient surgery.
Absolutely, it's outpatient surgery, and generally
Okay.
they may take some pain medications for a day or two, and generally they say they don't need any more after that.
Okay.
They're in at home, they're on their computer walking around. But we try to have them not at work because we don't want them to become too. They're still recovering from surgery, and so we don't need them to be particularly taxed. But they're often at home on the computer, walking around, doing their daily activities. We see them about 6 days after surgery, and we suction and look inside their nose and clean their nose a little bit, and there's a little bit of oozing. There's a congestion for that first week, and then their breathing significantly improves after that going forward. So the downtime isn't significant. There is no gym for about 2 weeks and no flights for about 2 weeks, and then they're off of work for about a week.
Okay, and that's it, really. So if it is that we want a consultation with you or make an appointment to do this procedure, how can we go about this?
So you can reach out to me or my office. I work in Kingston, Jamaica, in Portmore, and in Montego Bay, but it's the same office in all 3 locations, meaning the same, just branches of the same office.
Okay.
You can find me on my handles at the Snot Doctor. So my website, thesnotdoctor.com, or on Instagram at the Snot Doctor, and on Twitter as the Snot Doctor. We can also reach out to our offices. I'll give you a telephone number.
Sure.
It's 876-968-3130. Or at our website at the office is www.fossajm.com. Or you can email us at the same at info at fossajm.com, as well as you can reach out to Fossa Instagram pages as well.
Okay, so you're the only one in Jamaica that does this surgery.
So I'm the only endoscopic sinus and skull-based fellowship trained surgeon in the English-speaking Caribbean that I am aware of.
So okay, that is good.
But there are other surgeons who do endoscopic sinus surgery.
Okay.
It's just that I spent a significant amount of my career just doing this alone, and this is what I spend the majority of my time currently doing.
Okay, interesting. And yeah, I mean, you told us how we can get in contact with you, and how we can go about this. For persons who are worried about the costing for doing this procedure, what can you say to that?
What I say is, it is not unaffordable at all.
Okay.
Insurance covers it well.
Okay.
And I work both in the private and the public setting, and I don't change my practice based on where I work. So there are patients who will have this surgery done at the Kingston Public Hospital where I work.
Okay.
Completely free. There's no charge.
Ew.
And there are charges at the office.
Right.
There are certainly longer wait times at the hospital, so to be fair.
Yes.
And certainly we've been able to consistently be able to do the surgery because of the good health coverage and affordability of the procedures.
Awesome. So people listening out there, you can get the surgery done. The surgery is effective.
Absolutely.
As he says, and it helps to allow you to breathe again properly.
Yes, ma'am.
That's interesting. So thank you so much, Dr. Mullings, for that.
Thank you, Jade. I really appreciate you having me.
Yes, and I really appreciate you coming on and educating us about this, things that we don't know of, It's always good to have new perspectives or new understandings on these topics.
Thank you.
Yeah,
again.
No problem. And thank you guys for listening to Unfiltered by Jade, and we'll be back next week, Tuesday. Thank you. Bam, 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 bam,